Fracture of the maxilla, nose, zygomatic complex and associated bones are commonly referred to as fractures of the middle third of the facial skeleton. In this diagram shows these are the nasal bones which are fractured during the any impact on the face or directly when the face is touched to any surface. These are the nasal bones, zygomatic bone. These are the maxillary bones which are fractured during the road traffic accidents. And this is mandible. Nose is a prominent facial structure and nasal bone fractures are the most common facial fractures. Compared to any other facial bones, less energy is required to fracture the nasal complex. The frequency of nasal fractures is high and often unnoticed by both maxillofacial surgeons and patients. Surgical anatomy of the face. So these are the nasal bones which fractured most commonly, and these are the cartilaginous part of the nose, and this area is maxillary area. This is orbital part, and this part is frontal process of maxilla, this one. The nose is divided into two parts, external nose and nasal cavity. In external nose, that is bony part and cartilaginous part, and nasal cavity have floor, roof, lateral wall and medial wall, that is septal wall. Skeleton of external nose. In the skeleton you see this one is frontal bone, nasal bones, and these are the cartilaginous part of the nasal cavity. This one is frontal process of maxilla. Nasal septum formed by the quadrangular cartilage, perpendicular plate of the ethmoidal and vomer. This is a septal wall. See the perpendicular plate of the ethmoidal bone. This one is vomer bone, and this quadrilateral cartilage is placed in this vomer bone. Vomer is roughly triangular bone, forms the inferior and posterior part of the nasal septum. See, this is the inferior part and posterior part. This one. Superior border articulates with the perpendicular plate of the ethmoidal bone. This superior part is attached with the perpendicular plate of the ethmoidal bone. Perpendicular plate forms the superior portion of the nasal septum. See this superior part of the nasal septum. This is anterior part which is formed by the quadrilateral cartilage, and this is lower and posterior part formed by the vomer. See and this one is crest. Blood supply of septum. This is most important, and in viva and theory exams it is frequently asked. Blood supply of nasal septum is anti-ethmoidal artery, posterior ethmoidal artery, spinopalatine artery, branches of spinopalatine artery. This is greater palatine artery and superior labial artery. This one is Little's area. It formed by the anti-ethmoidal artery, spinopalatine artery, superior labial artery and greater palatine artery. This is Caselback's plexus, also called Little's area, most frequent cause of epistaxis, usually finger trauma or other any cause which injure the anterior part of the nasal septum can cause, septal mucosa can cause the nasal bleeding. This diagram shows the nerve supply of the nose. Biomechanics of nasal flexus. Nasal flexus occurs in one of two main patterns, either lateral impact or from the head-on impact. In lateral impact, the nose displaced away from the midline on the side of the injury. Lateral impact होगा तो नोज को लेटरली प्लेस करेगा और फ्रैक्चर लाइन डेविएशन होगा या तो लेफ्ट या राइट. In this diagram shows this perpendicular plate of ethmoid and this is vomer and this is nasal bone. These are the fracture during the lateral impact. In head-on impact, the nasal bones are pushed up and splayed so that the upper nose appears broad, but the height of the nose is collapsed, saddle nose deformity. अगर हेड ऑन इम्पैक्ट होगा, ऊपर से प्रेस करेगा तो ये नेजल बोन फ्रैक्चर होके डिप्रेस हो जाएगा, नेजल ब्रिज वाइडन हो जाएगा और नोज है डिप्रेस्ड होके सैडल नोज डिफॉर्मिटी शोज करेगा. Approximately 80% of fractures occur at the lower one-third to one-half of the nasal bones. This area represents a transition zone between the thicker proximal and thinner distal segments. Classifications. Types of fractures are: class 1 fractures are 7-8 fractures. Very little force is sufficient to cause a fracture of nasal bone. It has been estimated to be a little as 25 to 75 pounds per square inch. Class 1 fractures are mostly depressed fracture of the nasal bones. Here is the fracture line, this side. It impact on this nasal bones. Clinically, this fracture will present as a depression over the nasal bone area. There may be tenderness and crepitus over the affected nasal bone. Radiological evidence may or may not be present. In fact, class 1 fracture of nasal bone is purely a clinical diagnosis. Clinical diagnosis कैसे करोगे? नोज वाले एरिया को क्रेपिटस पाल्पेट करते हैं. अगर क्रेपिटस है तो it means it's fracture. Sometimes the fracture line not seen and there is a hairline fracture. Class 2 fractures are: these fractures cause a significant amount of cosmetic deformity. In this group, not only the nasal bones are fractured, the underlying frontonasal process of the maxilla is also fractured. The fracture line also involves the nasal septum. In this case, the fracture of nasal bones with maxillary area and the septal cartilage. And on the nose, see the depression of nasal bone. Class 3 fracture, these are the most severe nasal injuries encountered. This is caused by the high velocity trauma. It is also known as naso-orbital fracture and naso-ethmoidal fractures. Here the nasal bone associate with orbital area and maxillary area. This diagram shows the laterally displaced fracture. See? This diagram shows the laterally displaced fractures due to the lateral impact of force. And this diagram shows the posteriorly depressed fracture due to the press on the head on pressure. Disarticulation of upper lateral cartilage. See the upper lateral cartilage displays the towards the left side. And this area shows the anterior nasal spine fracture. Anterior nasal spine is the area where the base of the septal cartilage is placed. Involvement of nasal septum. The nasal septum is almost always involved in the nasal fractures and must be evaluated to determine if treatment is necessary. If the impact force is weak, nasal bone displacement is usually present without septal fracture. Clinical significance. Most nasal fractures cause significant bleeding. Proper techniques for hemostasis should be applied before any diagnostic procedure and any definitive treatment. Prompt appropriate treatment to prevent functional and cosmetic changes. Because of the nose central location and proximity to important structures, the clinician should carefully search for other facial injuries in the presence of nasal fracture. Because most of facial fractures can cause the nasal bone fracture, maxillary fractures, orbital fractures, and associated with mandible fracture. So proper diagnosis should be done before surgical management started. Diagnosis should be made with history of the patient. Physical examination and radiographic investigations must be done. The direction and strength of the impact should be noted. Pre-existing nasal or septal deformities should also be considered. A history of nasal bleeding may indicate a mucosal laceration. Skin laceration over the nasal area may guide fracture diagnosis to the specific anatomical area. This diagram shows the clinically we diagnose the fracture of the nasal bone. Index and thumb placed on both sides of the nasal bone and move side to side. If the bone is fractured, there is a clicking sound is present in examination. These are the different methods how to diagnose the fractured nasal bone. Radiological investigation. The usual facial radiograph may not clearly reveal a nasal fracture. In 1957, Gillies and Millard recommended Waters view. Lateral view CT scan accurately demonstrate the most nasal fracture and their displacement. Usually we advise the nasal bone for nasal bone fractures, lateral view of nasal bones. In lateral view of nasal bones shows the fracture line easily. For complex fractures, we advise the CT scan. Management of nasal fracture can do in the two ways: emergency management and surgical management. Emergency management, elevation of the head. हेड एलिवेट क्यों करवाते हैं? हेड एलिवेशन से ब्लीडिंग कम होती है. जितना हेड एलिवेट करेंगे 30 डिग्री या 40 डिग्री तो ब्लड फ्लो लोअर लिम्स की तरफ जाएगा, उससे ब्लीडिंग के चांस थोड़े कम होते हैं. और हेड एंड लो रहेगा तो नेजल ब्लीडिंग थ्रोट के अंदर जाएगी और एस्पिरेशन के चांस होते हैं. जैसे पेशेंट अनकॉन्शियस है, अगर हेड एंड लो रहेगा तो नेजोफेरिंक्स होते हुए लैरिंग्स के अंदर ब्लीडिंग, ट्रेकिया के अंदर ब्लीडिंग जाएगी, एस्पिरेट होते ही पेशेंट की डेथ हो सकती है. इसलिए हेड एंड लो नहीं होना चाहिए. Use cold compresses in the periorbital and nasal regions can be helpful for subside the edema. Nasal packing is the most common method of controlling bleeding within the nose. The packing should be placed precisely at the bleeding site to provide uniform pressure over the entire area. If the patient had head injury, the anti-nasal packing should be avoided. अगर हेड इंजरी के अंदर आप नेजल पैकिंग करोगे उससे प्रेशर बढ़ेगा और इंट्राक्रेनियल प्रेशर बढ़ने से ब्लीडिंग और होगी. अगर हेड इंजरी है तो सेरिब्रल हेमेटोमा के चांसेस ज़्यादा रहेंगे. तो वी शुड अवॉइड नेजल पैकिंग ड्यूरिंग द हेड इंजरी. इफ वी सस्पेक्ट हेड इंजरी वी शुड contraindicated anti-nasal packing. In most patients, packing will control nasal bleeding. After 2 to 5 days, the packing can be removed. Posterior nasal pack is needed when the obstruction of the airway because of hemorrhage into the nasopharynx. If the bleeding is not controlled by anti-nasal packing, then we should posterior nasal packing should be done. That is done by the catheter. Anti-nasal packing, this packing is done if localized bleeding is profuse or bleeding point is not localized. If diffuse bleeding, then we should do the anti-nasal packing. Use of ribbon gauze soaked with liquid paraffin. It can be done with vertical layers and horizontal layers. It can be removed within 24 hours and can be kept up to 2-3 days. Systemic antibiotics should be given to prevent sinus infection and toxic shock syndrome. In this diagram shows the anti-nasal packing in the ribbon gauze in layers. This diagram shows the posterior nasal packing. This is the catheter usually used in the urology department. ठीक है? This area shows the balloon, posterior balloon. This catheter placed in the nasal cavity. When the posterior end placed in the nasopharynx, we put the 10 ml of normal saline in this catheter. So the bulb inflated and the the corona part is blocked by this posterior part of catheter. Foley's catheter and insert the device into the nostril. Visualize the catheter tip in the back of the throat. Inflate the balloon with up to 10 ml of sterile water. Withdraw the balloon gently until it sits posteriorly. Pack the anti-nasal cavity with balloon device or layered ribbon gauze. Apply a padded umbilical clamp across the catheter to prevent inlet necrosis and to keep the balloon from dislodging. एंटी एंड होता है कैथेटर का, उसके चारों तरफ रिबन गॉज डालते हैं और एंटी नेजल पैकिंग भी करते हैं. अगर आपने पोस्टीरियर पैकिंग कर दी, एंटी नेजल पैकिंग नहीं की, तो एंटीली ब्लीड करता रहेगा. सर्जिकल मैनेजमेंट, नेजल ट्रोमा, इफ द फ्रैक्चर हिस्ट्री है तो क्लासिफाई द फ्रैक्चर. अगर नहीं, फ्रैक्चर इज नॉट प्रेजेंट, देन वी कैन डिस्चार्ज द पेशेंट. How to classify the fracture? Type 1 simple, type 2 simple, type 3 comminuted, and type 4 complex, and type 5. These are the types of fractures. In simple fractures, we discharge the patient after primary treatment, and if the complex fracture is evacuate and pack septal hematoma, irrigate and close the wound. If the significant edema, fracture reduction, meticulous septal examination with or without endoscope, close reduction. अगर फ्रैक्चर है, क्लोज रिडक्शन से हो सकता है, बिना इंसिजन के, तो क्लोज रिडक्शन करके पैक करके पेशेंट को डिस्चार्ज कर सकते हैं. और अगर कॉम्प्लिकेटेड फ्रैक्चर है, देन वी ओपन द एरिया थ्रू द इंसिजन इन द नोज and do the open reduction. Close reduction is usually reserved for simple non-comminuted nasal fractures. The indication for close reduction are unilateral or bilateral fracture of the nasal bone with displacement. यदि नोज का फ्रैक्चर लेटरली डिस्प्लेस्ड है, लेफ्ट राइट साइड की तरफ डिस्प्लेस्ड है, तो लेफ्ट से प्रेशर देके उसको फिंगर से भी कर सकते हो, थंब प्रेशर से हो सकता है, या नोज के अंदर एलिवेटर से उसको प्लेस कर सकते हो आप हल्का सा प्रेशर देके. दीज आर द क्लोज रिडक्शन मेथड्स. Fracture of the nasal septal complex causing nasal airway compromise. Close reduction should be performed as soon as possible, preferably 10 to 14 days post injury, but may be possible up to 21 days. Fracture reduction instruments. These are the instruments used in the nasal bone fracture reduction. This is S forceps, and this is Wallstrom forceps, and this is the nasal speculum, and this is Boyce elevator. In laterally displaced fracture, the elevator placed inside and pressure done towards the opposite side. In centrally displaced fracture, these are doing with elevator. Reduction of the nasal septum. In this diagram, the septum is this is the S forceps and placed in the nasal cavity, and we reduce this septum towards the anteriorly. After reduction, adhesive strips are placed over the skin of the nasal dorsum, and the nasal bones are splinted using an external splint that conforms to the patient's nose. If the nasal bones are comminuted or loose, they should be supported with an intranasal packing, which should be placed before placing the external splint. So this diagram shows the splint. After reduction, we place this splint for 21 days. If the septum is also involved, then we do the anti-nasal packing. The nasal septum can be stabilized with splint or packs. Removal of packing and splints. Hemostatic packs are removed after 24 hours. Anti-nasal packing is usually removed after 24 to 48 hours. Packs that are supporting the nasal bones are left in place as long as external splint is in place. The patient should be prescribed antibiotic treatment for as long as nasal packs are in place. Open reduction. Essentially, in two conditions, open reduction are performed. First, early correction of the nasal fracture that could not be properly reduced a closed fashion. Secondly, correct a previously existing nasal deformity. The latter should be more properly classified as septorhinoplasty to correct an internal and external deformity. Indication for open reduction: extensive fracture dislocation of the nasal bones and septum, fracture dislocation of the lower septum, open septal fractures, deformity after close reduction, inadequate bony reduction due to deformity, combined deformities of septal and alar cartilage. These are the indications for the open reduction. Surgical approaches are through existing laceration. ऑलरेडी जो लेसरेशन हो रखे हैं उसके थ्रू भी जा सकते हो. बाई कोरोनल अप्रोच, एंडोनेजल अप्रोच दैट इज ट्रांसकार्टिलेजिनस, रिट्रोग्रेड, बाईपेडिकल, कॉन्ड्रोक्यूटेनियस फ्लैप और ओपन अप्रोच. यूज ऑफ एग्जिस्टिंग lacerations. In this diagram, see the lacerated wound. So we can reduce the nasal bone through this wound. Nasal fractures are often associated with laceration. These existing soft tissue injuries can be used to access directly the nasal bones for management of the fracture. In this case, usually we not given the extra incision. This lacerated wound is sufficient for the nasal bone reduction. This is bicoronal approach. The bicoronal or bitemporal incision is used to approach the anterior cranial vault, the forehead and the upper and middle regions of the facial skeleton. For endonasal and external technique are accomplished through the various incision strategically placed to allow for careful anatomic dissection of the underlying nasal skeleton. The following incisions are given: alar cartilaginous incision, intercartilaginous, marginal and septal incisions, complete transfixion, partial transfixation and hemitransfixation, and transcolumnar incision. These are various types of incision given at the nasal area. These are the various type of incision. This is external approach. This is V-shaped incision. These are the different type of fractures of maxilla, frontal bone, nasal bone. The plating is done. Midline repositioning of the quadrangular cartilage of the septum and the vomer. The septum is repositioned in the original midline position together with the quadrangular cartilage and vomer. As a small suture may be placed from the anterior nasal spine to the anterior portion of the septum to maintain its reduction. These are the sutures given: anterior nasal spine and quadrilateral cartilage. Post-operative care. Post-operative positioning, keeping the patient's head in a raised position both preoperatively and post-operatively, may significantly improve the edema and pain. Nose blowing, the prevent orbital emphysema. Nose blowing should be avoided. Ice packs for reduce the nasal edema. Complications are early and late complications. Early complications: septal hematoma, edema, ecchymosis and apoptosis, infection, emphysema. Late complication: untreated hematomas of the nasal septum may become organized, resulting in subpericondylar fibrosis and thickening with partial nasal airway obstruction. Synecdoche may form between the septal and turbinate in area where the soft tissue lacerations occur and the tissues are in contact. What is synecdoche? Nasal septum और lateral wall के बीच में जो स्किन होती है वो जुड़ जाती है, दैट इज साइनेकी फॉर्मेशन. यूजुअली सेप्टोप्लास्टी या इंजरीज जो सेप्टम और इंफी टर्बिनेट की इनमें हो जाता है. रेजिडुअल ऑस्टियाइटिस इज सीन ओकेजनली इन कंपाउंड फ्रैक्चर्स ऑफ द नोज और इन फ्रैक्चर एसोसिएट विथ इन्फेक्टेड हेमेटोमाज. डेक्रायोसिस्टोराइनोस्टोपी may be needed for its correction. Why DCR advised in these cases? Nasolacrimal duct ये inferior mutation में ओपन होती है और ये ऑर्बिट से स्टार्ट होती है. कहीं भी इसका फ्रैक्चर होता है मैक्सिला का या कहीं भी तो इंजर्ड हो जाती है, तो उसमें DCR करना पड़ता है, डेक्रायोसिस्टोराइनोस्टोपी. नोज के अंदर ओपनिंग बनाते हैं जिससे लैक्राइमल सिक्रीशंस इसके थ्रू निकलते रहते हैं. क्लोज्ड वर्सेस ओपन रिडक्शन. नेजल बोन फ्रैक्चर्स कैन बी ट्रीटेड बाय आइदर क्लोज्ड और ओपन टेक्निक्स. बिफोर चूजिंग ए मेथड ऑफ रिडक्शन द स्टेटस ऑफ द सेप्टम मस्ट बी एस्टैब्लिश्ड. If the septum is fractured and displaced, Attempts at closed reduction often result in unsatisfactory results. Closed treatment should be reserved for simple unilateral displaced nasal fractures without any significantly displaced septal fracture. Results following closed reduction have been examined in in past reports. Timings of treatment. There are difference of the opinion regarding timings of the treatment of nasal fractures. If the patient seen in shortly after trauma before significant edema develop, immediate treatment may be indicated. Other indications for immediate treatment include the person's presence of lacerations with exposure of the underlying skeleton or cartilaginous element or the presence of septal hematoma that require immediate drainage. Immediate और late reduction का importance यही है. Immediately अगर reduction कर देंगे तो इडिमा के बाद फ्रैक्चर लाइन का पता ही नहीं पड़ेगा. इसलिए इमीडिएटली अगर रिडक्शन कर सकते हो तो इमीडिएटली कर देना चाहिए. अदरवाइज अगर इडिमा हो गया तो 7 to 10 days का वेट करना पड़ेगा अपने को रिडक्शन के लिए. However, many surgeons said to re-evaluate the patient in a number of days before performing definitive treatment. By re-evaluating a patient a number of days after a trauma factor that may contribute to the post-operative nasal deformity, such as acute edema, recognized pre-existing nasal deformity and undetected septal fracture can better be assessed before surgical intervention. अगर ऑलरेडी उसका डिफॉर्मिटी है तो फर्स्ट वी इवेल्युएट द सेप्टल डिफॉर्मिटी और द nasal deformity. Local versus general anesthesia. Reduction of nasal fracture may be performed under local anesthesia supplemented with intravenous sedation or under GA anesthesia. It depends upon the patient to patient. Skilled management of the nasal and septal fracture require a detailed understanding of the facial anatomy, causes of injuries, function, aesthetics of the nose, modern operative techniques, timings for reconstruction, setting and anesthesia choice and possible complications. Although most operative repairs have good results, secondary reconstruction are surprisingly common. Accordingly, long-term follow-up may be helpful in select patients, but most patients should be informed of the possible long-term aesthetic and functional consequences of their injuries. These are the facial trauma fractures. This is head and facial trauma, maxilla, mandible and cranial fractures. These are the fracture lines in this area. This is CT scan picture. And this is X-ray lateral view. In lateral view, the nasal bone easily shown. दिख रही है nasal bone, this one. We usually advise lateral view of nasal bone for fractured nasal bone. This is PNS Waters view. These are different pictures of lacerations and fractures of face and so these are the fractures of maxilla, mandible and nasal bones. And in neck trauma, there may be fracture of the thyroid cartilage, injury to the laryngeal area. This one is tracheal injury. Sometimes the road traffic accident can cause the blowout of the carotid arteries. If the blowout injury to the carotid artery, it can cause the sudden death. If the proper treatment, immediate treatment is not done. So different type of injuries, face or necks, can cause the death of the patient if the immediately some complicated a. So first of all, airway should be preserved. Okay, if the tracheal injury or laryngeal injury, we should do the endotracheal intubation, and if the endotracheal intubation is not possible, then tracheostomy should be done immediately.